various things. What stops transgender responses in Asia-Pacific are various fronts. First of all, lack of strategic information, of data that we don't have to inform effective programs. Second is stigma and discrimination in various settings, in communities, in families, in even religious sites, and also in health settings. And also, laws and legal environments are not favorable for them to be recognized and exist, so drives them underground. They are very visible but invisible in terms of public access, or in terms of recognition in their national documentation, and also in terms of HIV. We cannot assess them given that they are hidden or underground. It's very difficult to access in terms of prevention programs, access to treatment. In terms of gender enhancement, most of the countries here in this region don't have the products that they need. They go online buying products on self-medication. Sometimes they don't know what are the side effects that it can provoke in their bodies. So there's a lot to do in terms of having effective programs for transgender in this region. So the barriers are huge, and we are here to support them to go one by one. First of all, get cohesion amongst themselves. Sometimes they are divided between the trans man and the trans woman. Get cohesion amongst themselves, getting together and raising awareness. They can be more involved. They can also, there's also the problem that when they are discriminated and stigmatized and also sometimes thrown out of houses or families or communities, they get lost. So, but sometimes if they come up and seek for support, they can also be supported in terms with some groups, creating more groups, supporting groups, creating more associations, creating more networks, so they are kind of a community that is sustained in cohesion. They can also get more involved in terms of informing what is needed best for them, being more at the center of the response at country level, getting more participation in national mechanisms like national strategic plans, CCMs, country coordinating mechanisms as well, getting more around the table with the capacity that are needed to inform the programs. WPATH is an association of medical professionals on transgender issues, and we, together with other agencies, thought it would be important to have the community, the voices of the community, to inform even this medical association of what would be better for them. Medical doctors staying amongst themselves only can talk about the clinic aspects and never the social and psychological aspects without consulting with them. So the interaction between the doctors and the community we thought would be a very good opportunity to start having this kind of dialogue. And this was the first one that it happened, and we are very happy with the outcomes that this dialogue started. Maybe in the next one it will be better interaction, and there's also a demand from both sides, from the community side but also from the health experts side. They both want to increase this kind of collaboration and partnership. You're not supporting because UNAIDS is, as a day when we need to bring both parts together to the table and then together developing some kind of work together. And this is where the health experts and the community can both create better products, standards of care, they can create a lot of guidelines together, they can create about qualities of services for them, but they also, the doctors can be more close to the community instead of being just accessible in the middle or upper classes, but also in the lower classes. They can also be there as informing, as respondents to their needs. They can be also in terms of answering when they are on auto-medication. They can call some experts at WPATH and get the information they need in terms of buying themselves on internet hormones. They can ask questions, is that good for me, is that good for me? So there's all these kind of openings that can happen, and UNAIDS is very happy that this interaction is happening. Both sides gain with this new interaction, and UNAIDS thinks that would be a good partnership in future to create good guidelines and better health outcomes.